Hello everyone, it's Princess and welcome back to my weight loss journey. So today is November 24th, 2020. Yesterday was the 23rd and I had 3 appointments yesterday. My first appointment was at the hospital that I'm going to for my surgery, but actually across from it. So I had to do a pre-anesthetic testing. So basically, first I went into the wrong place thanks to my uncle because he took me to the wrong place. So I sat there for a little bit. Then I finally had to walk to the real place, and then basically I sat down and I was the last person to be seen. So my appointment was at 11. I didn't get seen until like 11:45, which was crazy. And then so I got up in there, and then me and this lady talked. We basically talked about my medicine, about making sure that I got all this testing stuff done. And basically I had to do a urine test, and then I had to do a test for Mesa. I'm not sure, but it's like you swab your nose, not like the coronavirus test. It's just the nostril part. You swab both nostrils, and that's testing for something. I'm not actually sure. Mesa, I think. And then I went to go get my blood drawn. I don't know if y'all can see the bruise that I got right there. I have they call them deep veins. Yeah. So I always get poked multiple times to get a blood test. I'm not sure what the blood test was for, but I know for a fact the urine test was for a urinary tract infection. And then afterwards, I had to go talk to an anesthesiologist. I believe that's her name. I was in there for 5 seconds because the last time I had anesthesia, I was fine and I'm healthy. So that was that. Um, Later on, I had an appointment at 1 o'clock, and this was my nutrition visit. And I'm gonna tell you one thing. I weighed 269. I'm gonna tell you why I gained 1 pound. Basically, I gained 1 pound because first off, that day it was 1 o'clock, so I drank. By that time I got there, I already had drinking 2 Slim Fasts and one yogurt drink, so that's just weight. And I had to pee, so that's more weight. And the lady did not give me a chance to take off anything, so I got weighed wearing my jacket full of my wallet, my phone, all this stuff, and then also holding 2 books, and then my shoes. So therefore, that's why I weighed 269. When I weighed myself on the 22nd, I was actually weighing 265. I was like, but that was also in the morning, so I don't know. We don't know, and obviously one thing, different scales are different, and so yeah, that's basically that. So I got this book. I never actually mentioned Cooper is actually doing my surgery. So I don't know if y'all have a Cooper where you live. But this is the patient handbook. It says weight loss surgery at Cooper University Healthcare. And that's the little thing to make sure you don't have coronavirus when they do your temperature. So this book basically has a lot of stuff. The first thing in here is talking about BMI and basically calculating your own BMI. So for being 5'4" which is me, your weight is supposed to be 145 pounds. So basically they're saying I would have to lose 124 pounds extra fat, and the sleeve would be like 72 pounds in 2 years. That's how much I would lose in 2 years. Like, well, that's the average. Then the next thing it has is non-surgical treatments for obesity. So stuff like weight loss medications. Then like, basically, I think that's it. And like exercising and stuff. So I don't want to go through the entire book because we'll be here forever. But one thing it does do is it explains the surgery. So this is the gastric bypass, the one my dad actually had. This is the gastric band, which they don't even do that one anymore because it's just not safe, they said. And then here's mine, the sleeve gastronomy. So I'm gonna read a little bit of this to y'all. So the stomach is divided vertically over a 3¼ inch tube, creating a long, narrow, banana-shaped pouch. So let me just show you. I can just show you. So this is what they cut off, and they remove it, and then that's your size of your stomach afterwards. And they don't mess with anything down here because the gastric bypass, they're like taking this and putting it up there and all that stuff. So they're just gonna remove majority of your stomach and keep you with that. Let me see. That's basically all I can explain to you. Sorry about the sun. It's like really crazy lately. So, risks complicated with surgery are allostasis, I think that's the name, when your lungs collapse, pneumonia and blood clots, and then obviously infections. So that's why soon after you get out of surgery, they want you to get up and walk in. And while you're actually not being able to walk, they put these things on your legs that basically walk for you. So I don't know why this sun is like annoying today. But I'm sorry about the sun, by the way. So a lot of things that come with the surgery could be, these are like risk factors like nausea and vomiting, ulcers, food intolerance, like foods that are difficult for you to tolerate after the surgery. If you have sugar, you will get dumping symptoms syndrome. So I don't know what it has. Dumping syndrome is basically where your body is like, oh my God, there's so much sugar, so much fat. So you start like getting cramps and stuff like that. I'm just going to hold it like this because that's annoying. So I'm just going to quickly go through this book. While I'm actually going through here, I want to talk to you about the 2-week liquid diet. So I start my liquid diet on the 15th. I'm getting like all mixed up on the 15th, and I basically bought a whole lot of stuff for it already. So I bought the Kellogg's vanilla cappuccino protein shakes, and I think I got 6 of them, or maybe 12. And then I got the chocolate mocha ones. I got 12 of them as well. I also got the Glucerna Hunger Smart Shake. I got 1 vanilla, 1 chocolate. I also I think I'm gonna buy more Slim Fast because I can have that for the liquid diet but not afterwards. And then I also got another Slim Fast that's bananas and cream. Then what I did is I went on Amazon and I ordered the Premier Protein Shakes. They had like a variety pack of all of them, so it's just 1 of each, so 7 of those. And I also went out and bought green tea. Then I also have decaf coffee in there already. I purchased Splenda. I purchased sugar-free popsicles. I have 2 Powerade Zeros, no, 4. 1 mixed berries and 1 fruit punch. And then I also went out and bought like a Gas X thing and also like some Colace, because they said since you're not going to be eating that much, you'll most likely will get constipated. So we don't want that. And plus, you cannot push that hard after surgery because then you will get a hemorrhage. I forgot where the intestines come through your like incision holes, and we don't want that because that's just more surgery. So right here it says test and preparation for bariatric surgery. So these are all the tests I had. So I had an upper GI, I had ultrasound of the right upper quadrant. I had a lot of blood tests. Then I met with the dietitian. I met with the psychologist, which I'm going back to see her on a second. And then I met with a pulmonary person. Then I met with a cardiologist. And then I had a lower extremity. I don't think I had that one. There's a lower extremity venous duplex exam. That's if you have like a history of blood clots, which obviously I don't. I'm healthy. So not saying that you're not healthy if you do, but you know what I mean. So, and then yesterday I had my pre-admission testing, which is commonly called PAT. So this book has a lot of stuff, which I kind of wish I would have had this first, because then I kind of would have known what I was doing. But this is day of your surgery and your hospital stay. So it says, remember to shower with the skin prep you were given. So I'm going to be given a skin prep. And what I'm understanding is that the night before, like right before I go to bed, I got to take a shower, shower all off, and then use this special soap with just my hands and just wipe everything. Like basically from here all the way down to like, your pubic area. And then leave it on for 5 minutes and then rinse it off and then use a clean towel. And then I got to do the same thing right before I come to the hospital. So basically what it does, it has the first day after surgery, the second day after surgery. So basically explaining what you'll be eating. Well, you can't really eat, but what you'll be eating, what you'll be drinking, what you'll be doing. So let me see. For the sleeve, it says, if you have a urinary catheter, it will be removed. If your urine output is adequate, blood studies will be checked. Your IV fluids will be continued. You may have a swallowing study to look for leaks or obstruction. You will have an appointment on your discharge papers with date and time for your test. So that's what your first appointment. I think it's like a week after the surgery. If you are doing well, you will be started on an amount of clear liquids by mouth at 1 ounce per hour, and it will be increased as tolerated. We expect you to walk in the hallways and to be out of the bed in a chair. You will use the PCA for pain control, but may also use oral pain medications. So yeah. The dietitian will see you before you go home to remove the post-operative diet with you. If you are doing well in the late afternoon, you may be able to go home late in the evening. So basically like that. And some days you have to stay like extra if your stomach's not tolerating it, obviously. They have basically, yeah. So the post-operative thing. So you're going to have to stay on a liquid diet. So let me see. I think this is just a regular liquid. This is like, because first, when you first get out of there, you have to do a clear liquid diet. That's only for when you're in a hospital. So it's only like water, broth, stuff like that. But once you get home, you can go back on a regular liquid diet like you're doing now. But you have to have certain protein shakes because it has to have at least 30 grams or more. So the protein shakes I'm drinking right now have like 15 grams of protein, so I can't drink them afterwards. Another thing I will be having is a injection to put in my stomach for 7 days. It says this helps to prevent the development of blood clots in the legs. So I guess while you're there, they say usually a visiting nurse will assist you, but I don't think during COVID they're going to have a visiting nurse. So he told me to just pinch my stomach and then rub it with alcohol and then, boom. And then walking. You need to walk several times a day, obviously for no blood clots. And they want you to breathe in deep so you don't get your lungs to collapse or get pneumonia. Then okay, so it says insensitive spirometer. The thing at the hospital where they make you breathe in. They want you to bring that home and they want you to do it every time you walk by it. So, and then medications. You will start taking chewable multivitamins daily. And yeah. So let's see. There's a lot of stuff on here that I don't need. But one thing is, after this surgery, you cannot take NSAIDs. So which is non-steroidal anti-inflammatory medication. So no Motrin, no ibuprofen, no Meloxicam, all of them. You can't take them anymore. And I think for the rest of your life, you can't take your multivitamins and your calcium at the same time. Which they say you're not really supposed to now, but I do it now because I just take them all at the same time. So here is dumping syndrome. All this stuff got highlighted for me, and me and the doctor, I went to the dietitian and to the nurse, and we all went through this book together. So dumping syndrome is a feeling of fullness and cramping which can lead to nausea, vomiting, diarrhea, or abdominal pain. So they said it comes from high sugar, high fat foods or drinks that pass quickly through the stomach. So you obviously don't want that. So that's why they say you should chew like 20 times per bite and don't eat and drink at the same time. Like no more the rest of your life. So here we go. So is this my surgery? Because they have like different surgeries in here. Okay, so day 1 to 3 after surgery, clear liquids only. So this allows your stomach to heal properly. Day 4 to 14 after surgery, the full liquids. This includes the clear liquids and liquids you do not see through, such as milk, protein shakes, strained cream soups, yogurt without fruit, and pudding. Weeks 3 and 4, puree. In the puree stage, you'll be having food that is the texture of thinned out mashed potatoes, so baby food. And then weeks 5, 6, and 7, you'll be having soft food. You will gradually increase the texture of your food to that of baked fish and ground meat. Then weeks 8 and beyond, regular texture. So now you can have whatever you want, basically. But obviously, still staying in your calorie count. And yeah. So let's see. So that's basically what it does. It goes through each stage. So stage 1, stage 2, stage 3. You don't really need to do all that right now. But basically, on Tuesday through Friday, I will be doing the clear liquids. Then on Friday through about 10 more days, I will be doing the full liquids, which I'm just going to explain some of the foods for you. So they have milk, protein shakes, obviously 30 grams or more, vegetable juice or V8, low-fat strained cream soup, yogurt, sugar-free pudding, and also any liquids from week 1, which these are just clear liquids. So then we had the puree, and they have a whole chart. Let me show y'all. They have a whole chart. This book is really informative. Like I said, I wish I had it before. Then I'll be having an appointment before I start my soft foods. And then, like I said, they should tell you a whole list of fat foods. And it also has a list of foods to avoid. Then on February 9th, I will be going back to my regular texture food. So basically what am I saying? I think I lied before. I'm starting my liquid diet on the 1st. And then, so basically from November 30th through February 9th, I won't be eating regular food. And so the supplements you're supposed to be taking are chewable multivitamins daily. So basically, I'm going to show y'all the ones. I'm not going to show y'all. I'm just going to read them to you. The ones that I put on my list so I can buy from Amazon. So they want the Flintstone chewable multivitamins, but they want it to say with iron because they want iron in it. And then I also am going to purchase these Premier Protein, high protein ones. And then they have Pure Protein complete shakes. So they all have 30 grams or more. Then I also have vitamin B complex by Nature's Bounty. Then vitamin B12, which the B12 you're only supposed to take once a week. And then the Tums you're supposed to take, I think, 2 to 3 times a day. So that is basically your vitamins. And 64 ounces of fluid per day. And not to use a straw for the rest of your life, which I think is crazy because my dad uses straw all the time. But that's my dad, you know. Let me see. They have tips to prevent complications, like eat your food slow, chew a lot, don't eat and drink at the same time. So daily you'll be having the multivitamins with iron, the calcium, which are just going to be Tums because they don't want you to take calcium anymore. So you're going to be taking Tums, then B complex, then vitamin D, which I have vitamin D already. And then the weekly is when you'll be taking the B12, or you can get like the injection once a month. I could just take it and put it under my tongue. That's easier. It says do not, and it's all in highlighted, do not take your multivitamin with your Tums because it interferes with the iron absorption. So if you take them at the same time, you won't get iron, then your iron will be low. Because after having any type of surgery like this, your vitamins and stuff are going to be off. So this video is pretty long. I kind of want to skip through. They have different surgeries, diet thing as well, like the gastric bypass, I believe. So basically that's the end of this book. I really appreciate this book. So basically next, I don't want to show this because it has an address. I have actually I have to go back on Monday. So Monday the 30th to get a weight checkup because I didn't lose weight, but I know I lost weight, so I'm not really worried about it. So I have to go back to there on Monday to get weighed in, and then on December 2nd, I have to go back to the psychologist. Then on the 7th, I'll be meeting with the doctor for the second time. Then on the 12th, I have to go get my COVID test and then quarantine until the 15th. Which another thing I have to mention, I have to get my nose ring taken out, which means I have to go to the place because this isn't a nose ring you can just take out. It's like it's supposed to stay in there forever. So I have to go there and have them take it out again. I had to do that in January this year. For my wisdom teeth. So this is another thing she gave me. This is basically a list of all the proteins. She wants me to aim to 65 to 85 grams a day of protein. These are all like proteins, like powders. I don't like powders. I like the ones that are already like mixed in. So they're Premier Protein, and then I'm getting like the pure protein as well. So those are the ones I'm gonna get. And then it has your medication on the back. And then it also has, which is funny because it doesn't say vitamin D here, but it says vitamin D in there. So I guess I'll ask and see if they want me to take vitamin D. Then this is just all the brands of them that you can get. Really informative. Then this is the Tui Liquid Diet. I already kind of had this before. And so yeah. And then this is for the day of surgery. So I'm going to read this to y'all. After midnight, consume only clear, non-carbonated liquids. Do not choose red or orange flavors. And do not have any protein shakes. If you are the first case of the day arriving at 6 a.m., 7 a.m., or 8 a.m., drink 1 32-ounce regular Gatorade, not red or not orange. So basically, I'm just going to get a blue one. And they want the full sugar one. And it says between 10 p.m. and midnight the night before surgery. If you are not the first case, 4 hours prior to arriving at the hospital, start drinking your Gatorade. And then they also want you to take 2 extra strength Tylenol. Can't take no more Motrin. Keep that in mind. No more ibuprofen. So the night before the surgery, she said they start calling people around 4:30. So on the 14th around 4:30, I should get a call explaining what time my surgery is. So then that's when I'll drink my Gatorade and stuff like that. And basically, I also had to sign my name on here. They wanted to make sure that you know. Then I had to do a little bariatric surgery quiz. That was funny. These are pretty easy. So it's basically about the stuff we just went over. So basically that is it. Like that's basically the update for now. Everything looks good. I'm assuming I'm gonna hear back from my test results pretty soon. But I just wanted to come on here and update you about stuff that was happening. And I had the nutrition consult yesterday and also the teaching class, which is with the nurse who is why is the sun like that? So annoying. With the nurse that I guess he's gonna be there. I don't know. But yeah, so thank you guys so much for watching. I will update you guys probably once I start my liquid diet. I think I'm gonna do like what I eat in a day. because right now, like I said, I'm still doing the 2 shakes and then dinner and then a light, like a sugar-free snack. So I'm gonna be doing that up until the 1st, and then the 1st I'll be doing a full liquid diet. So y'all will be getting a video about that, and then basically, yeah, maybe if I do like a shopping, then we can do that as well. But yeah, thank you guys so much for watching me on my journey. We are almost at the finish line. The surgery is not too far away from now, and I'm really excited. I'm really nervous at the same time, but I also know that I'm going to be so motivated once everything gets done, and I'm going to be eating so good, and I'm just ready to be on this journey. So please make sure you watch all the videos in this playlist, especially if you are going through the same thing I'm going through. Even if it's just a regular weight loss journey without surgery, it's still kind of the same thing. So see you later, guys.